Hi.
Hi, ma'am. How are you?
Hi, very good, thank you. Let me just adjust my.
Greetings to our dear viewers. Welcome to Health Talks brought to you by MediGence. Through these health talks, MediGence helps to connect you with global medical leaders for our viewers to take insightful medical decisions. In our talks,
Uh, Ma'am, sorry for the inconvenience. Just wait for a while. We are having some internet issue at our end. We are just resolving it. Just give me a minute. Yeah.
hi, Dr. Tanujaa.
Hi. Can you hear me?
Yeah, I can hear you now very well.
Okay.
So today we are in an insightful conversation with Dr. Tanuja, senior consultant at Parkway Cancer Center, Mount Elizabeth, Singapore. Welcome, ma'am, to the show. So
Thank you. Thank
today
you.
we will be okay. Today we will be discussing basically about early detection, prevention, empowering lives, and understanding breast cancer. Okay.
Okay.
So first question to you, Dr. Tanuja, how would you like to explain breast cancer at a cellular level to our viewers?
Okay. So
For a
the
layman to understand, basically.
Okay, so exactly what exactly is cancer? So cancer occurs when cells develop when the cells in the breast develop a mutation. A mutation is essentially an abnormality in the DNA, and this mutation or this abnormality in this cell's DNA causes the cell to divide and grow uncontrollably. Normally, the cells are not like that. So when in the cancer cells, what happens is when this mutation occurs, the cells
Okay.
divide and grow uncontrollably and until they affect the function of the organ. And
Okay.
eventually, these cells can spread to other parts of the body, and that is called metastasis. So, for example,
Okay.
the cancer cells can spread to the lungs, can spread to the
Mm-hmm.
bone, can spread to the brain, and then eventually affect the function of these organs as well.
Okay, okay. So, what are the most common symptoms that are present but are ignored by the women generally? Because uh, you, the I have heard a lot of our ancestors tell us that you should go and while taking bath, give a massage to the chest area, drain your there should be lymphatic drainage in the armpit area. But in this fast-paced life, we tend to ignore all this. So, what are the most common symptoms which are present but are ignored by the women in general?
I think the most common symptom that occurs, right, in most women with breast cancer is a lump. So
Okay.
if you feel a lump in your breast, don't ignore it. But a lump does not immediately equal to breast cancer because you can have
Okay.
benign lumps. But there's no way for you as a layman to be able to just feel your breast and say, oh, I have a lump, this is going to be benign, let me ignore it, or this is going to be cancer, right? You need to be seen by a medical professional and get it worked up. Right.
Okay.
Other symptoms that can happen in breast cancer is, for example, nipple retraction. So that means the nipple turn inwards, or you may have dimpling of the skin. So the skin around the breast does not look normal. You see skin changes. And
Okay.
sometimes, you can, if you feel your armpit area, you may feel a lump, right? Or even this area, you see there's your collarbone, the area above, you may feel a lump, right? These are lymph nodes. So these are certain things that can happen. And if that happens, essentially go and seek medical attention to get evaluated.
Okay. So this is a very important point for our viewers to understand that they should not just worry that when they find a limp it might be a cancer. They should first go and get it checked, and then a proper diagnosis would be made about the illness. So any lump should not be considered directly as a cancer. Am I right?
Absolutely. Correct. So some people are very fearful, right? They think lump equals to cancer, and then so I don't want to get it checked. That's not true, right? Some,
Exactly.
especially in younger women, they may have lumps in the breast that occur with the menstrual cycle, right? But sometimes you would never be able to tell, is this benign or is this not benign? If there's a lump that is persistent, definitely go and get it checked.
Okay. So, Dr. Tanuja, like I have observed, as you rightly said, that people who have are undergoing a menstrual cycle or in their menstrual age, they tend to get these lumps. Also, is it possible for mothers who have recently had their child, would they also, because they are feeding and they do not
Breastfeeding,
get
yeah.
a menstrual cycle for at least 11 to 12 months after delivery? So, is it possible for them also during this period to get any lumps?
Yes, absolutely. So it's not uncommon when you are breastfeeding, right, to have lumps in the breast. Sometimes, it can be what we call mastitis, inflammation in the breast. But the general rule to anyone is that if there is a lump, even when you are breastfeeding, if it is persistent, definitely seek medical attention. Actually, now that you've mentioned it, recently I actually saw a mother who was breastfeeding and had a persistent lump, and she was smart enough to go and get it checked, and this was essentially came back to be breast cancer that was diagnosed when she was breastfeeding.
And if a child abruptly starts gets weaned off from taking the mother's milk, then also are there chances that the women develop lumps in the breast?
I mean, that is not a risk. I mean, that is not a risk, but I think if, let's say, that if the kid suddenly rejects the breast, right? I mean, it does not equal to cancer, right? So, I mean, if there are any abnormalities or a persistent pain, persistent redness, or anything like that, or inflammation, infection, get it checked by a medical professional. I think that would be the key.
Great, great. So, how does family history and genetics influence a woman's risk of developing a breast cancer?
So if you have a first degree relative, meaning like a mother, sister, or a daughter who has breast cancer, that almost doubles your risk of getting breast cancer, because we know that in breast cancer, some people may have inherited mutations, such as what we call the BRCA1 or BRCA2 mutation. These
Okay.
genetic mutations were made very popular or famous because of Angelina Jolie. So,
Yeah.
so she was found to have these mutations, and she was found to have inherited these mutations, and so her risk of breast and ovarian cancer was known to be high. So, if you inherit one of these mutations, there's a 40 to 60% chance of lifetime's chance of getting breast cancer. And she decided to do something about it. So she went for a prophylactic mastectomy, and she removed her ovaries and uterus before she could develop cancer. But the aim, I mean, there's no need to do anything drastic. The main thing is, if you have a family history let's say if you have a mother or aunties who have breast cancer, or male relatives with prostate cancer, then seek a medical professional's opinion to see whether you would require to go for genetic testing. With any test, there's obviously pros and cons about doing a test, and then you want to discuss that with a medical professional and talk about going for testing for yourself if you have a very strong family history.
So, what is the recommended age that a woman should start getting their screening done if they have a medical family history?
Okay. So whenever we talk about breast cancer screening, generally, so from where I come from in Singapore, for any women, it is encouraged that they go for mammogram screening at the age of 40. So if you turn 40, you would go for yearly mammogram screening. This is part of the national guidelines. But if you have a family history of breast cancer, that means, for example, if I have a mother who had breast cancer at the age of 50, I would want to start screening for myself at least 20 years before when my mother was diagnosed. So I would start getting myself screened at the age of 30. And the sort of screening that I would undertake, because in young women, mammogram may not be very useful because the breast is very dense. You may want to speak to your doctors about getting MRI screening of the breast, or even ultrasound screening.
Dr. Tanuja, what about the people or the women who do not have a family history or a genetic history of the same? So when should they be, because as far as I know that mammogram should be done only after the age of 40. So what are the preventive screening tests that should be done by people who do not have a family history, and what is the relevant age that they should start for the
So
same?
if you don't have a family history, then you would do the regular population screening. So different countries may
Okay.
have different regulations, but in Singapore, it's the age of 40. So in Singapore, breast cancer is the number one most common cancer among women. So when you turn 40, every woman is encouraged to go for mammograms, right?
Okay.
Yearly mammogram. Yeah, that
Okay.
that is that would be the recommended screening guideline.
Okay. Okay. So, for our viewers, can you explain how mammography, ultrasound, and MRI differ from each other, and what are the um, stages of cancer that they detect?
Okay, so mammogram uses X-rays, and generally it's better for women above the age of 40, right? Ultrasound uses sound waves and is generally used more ideal for younger women with dense breasts, right? Because when in younger women, when the breast is very dense, mammogram miss out lesions in the breast. So ultrasound may be something else that we may want to use, right? The MRI, on the other hand, is something that is highly sensitive and is used for high-risk patients, or patients who initially had a mammogram and we can't see things very clearly. We may then go on to do a MRI. These tests sometimes complement each other, then rather than replace one another. But usually, which test would be suitable for you? You need to have a discussion with your doctor. Sometimes we may do mammogram is the screening, but we may not be able to see some parts of the breast very clearly. Your doctor may say, okay, maybe I want to evaluate this better, go for an ultrasound. Yeah.
Okay.
All of these three tests are tests with different modalities, different benefits that come with them. So they complement each other. So depending on the problem that we're dealing with, your doctor may order one of these tests.
Okay. So, ma'am, what are fibroademas? I mean, how how are they differ from how these cysts and their lumps, and why are they so commonly seen in the younger women?
So you're absolutely right. Fibroadenoma is a benign tumor that's generally seen in women who are usually in under 30 or in their 30s. This is a type of it's a benign tumor that's made up of glandular and fibrous tissue, and hormonal fluctuation, especially estrogen, stimulates their growth. So generally you see this in younger women, right? But it is not possible for you to just touch and say, oh, this is a fibroadenoma, this is a cyst, this is a breast cancer. So these any lump in the breast needs to be evaluated by a doctor. I think that's the message that we want to send out to the viewers. And
Yes,
the second thing being that all lumps does not equal to breast cancer. As you rightly said, it could be something benign like a fibroadenoma.
yes, yes. And do you feel that, as you rightly mentioned about the estrogen levels and the cortisol levels because of the stress we deal with in today's lifestyle, do you feel that today's lifestyle is contributing to the increase in such kind of incidents in younger women, especially fibroademas?
I, okay, so I don't know about stress causing fibroadenomas, but it's generally hormonal fluctuations,
Yeah.
estrogen fluctuations. I think it's not unfair to say that our breast cancer incidences in young women are increasing compared to
Mhm.
the past, right? There are
Yes.
many
Because
factors.
these lifestyle do cause hormonal imbalance.
Yeah, it could be many factors may contribute to it, as you rightly mentioned. Could be our lifestyle, stress, dietary habits, right? Compared
Mm-hmm.
to the past, nowadays we have a lot of processed food in our
Yeah.
diet, and we have
Mm-hmm.
more people who are obese, and
Yeah.
these increases the risk of breast cancer generally.
Okay. So, as we are talking about the lifestyle, we see very young children now getting their menstrual cycles at the age of 8 or 9, which used to be like 14, 15 in earlier times, and the menopausal age has also come down to, yeah, 35, 38, sometimes 42 as well. So obviously these are the results of lifestyle, and does this in any way contribute to the increase in breast cancer incidence in younger women?
So, one of the risk factors for developing breast cancer is we say early menarche, meaning early age of getting your menses, the early age of getting your first period. So that's the
Yeah.
date of menarche, and late menopause. So that means if you start your menses very early and you end your menses very late, then you
Yeah.
have prolonged exposure to estrogen. And that is basically saying that increases the risk of getting breast cancers, right? So essentially, early menarche definitely would be a risk factor for increasing breast cancer rates.
So we have spoken about the detecting a lump with our self breast examination. We have spoken about early screening, but sometimes there is nothing present, and someday you realize that you have this disease. So during that time, I'm sure there must be some red flags which come to us, that must not be ignored and taken up as soon as possible.
Yeah,
What
so
are those red flags?
I think the main thing is a persistent lump. So I think in my practice, I've seen a lot of actually it tends to be more of the older women who have had a breast lump for a longest possible time, and then they say, oh, it's been there for a long time, so I'm just it's not a problem. They ignore it, but this lump has slowly been growing, right? And eventually it turns out to be cancer. So I think if you have any lump that is persistent, please get that worked out, because I think the main thing is if we discover cancer at an early stage, the chances of cure is much higher. Other things, other red flag signs that we should watch out for are, let's say, a nipple discharge. If you're having a bloody nipple discharge, or you notice their skin changes, we call like dimpling of the skin. If you find that your skin is not so smooth, they are like it's like as if you're having multiple dimples on the skin. Again, that is not normal. You need to get that worked out. Or if you find that there are lumps in your armpit, right, or lumps in your neck, definitely get those worked out as well.
So, do you feel, Dr. Tanuja, that AI and digital imaging have improved the diagnostic accuracy in the recent years?
Definitely. So in Singapore, some of our radiologists use AI in the mammogram in the programs, right? And that helps to pick out lesions or abnormalities better than compared to when we didn't have AI. So I think I think increasingly with the use of AI, we should be it will be a blessing to our patients. We should be able to pick out more abnormalities.
So, Dr. Tanuja, since we are addressing the common people in this webinar, I would like you to throw some light on, you know, I don't know how true it is, but is it a myth or a fact that tight clothing do contribute to, increase in the lumps in the breast or women? I mean, continuous use of such tight clothing. Is it a myth or is it something that is true and the people should be careful about it?
Okay, it's a myth, right?
Okay.
So there is no scientific evidence that shows that wearing tight clothes or wearing a tight bra all the time increases your risk of breast cancer, right? So there's no strong scientific evidence to say that's the case.
Yeah, because most of the people do have this myth and then they think about that. So it was important for us to address such uh,
Absolutely, I agree.
myths during our webinar for you. Okay. So we have talked about the early detection till now. What are the preventive measures that a woman can follow to basically not get into this disease or not have this disease? What is the message that you want to give to a younger women
Okay,
or
so
women in general?
I think there is no way to prevent breast cancer, right? But what we can do is decrease our risk factors for getting breast cancer. So what are some things that we should do is firstly, number one, if you want to keep a healthy weight, right? Because we know obesity increases the risk of breast cancer. So keep a healthy weight and exercise. Exercise is very important. We want to ensure that we get in 30 to 40 minutes of moderate intensity exercise 4 to 5 times a week. Okay? And thirdly, what we want to do is also avoid processed food. We want to have a healthy, well-balanced diet which is rich in, fruits, vegetables, and you want to avoid your processed foods like your sausages, your potato chips. So those are certain things that you want to do. And also for younger women who are starting your family, and if once you have your children, you want to breastfeed your children because we know that breastfeeding decreases your risk of breast cancers. And we also know that in older women who are undergoing menopause, the use of hormone replacement therapy increases the risk of breast cancer as well. So you want to be careful about using hormone replacement therapy. And lastly, I think keep up to date with your screening, right? It is important to go for your regular mammograms. You may not have the aim of mammograms is to pick up breast cancer at an early stage before any symptoms develop, right? So
Yeah.
that if we pick it up early, the chance of cure and is much higher. So I think that would be my advice for any women, myself included. Yeah.
So, Dr. Tanuja, we get a lot of requests because we deal with medical travel. So we get a lot of requests from females around the globe for cosmetic procedures related to the breast. So are these contributing factors or are these dangerous for or a risk factor for developing cancer of the breast?
Okay. So there is no clear evidence at this point of time to say that, breast augmentation, going for cosmetic procedures of the breast increases the risk of breast cancers at this point of time. But sometimes whenever you have, let's say, implants and things like that, you may not be able to heal lumps,
Yeah.
easily compared to normal breast treatment. So you want to be more, if you had a breast augmentation procedure, you want to be a little bit more careful when it comes to screening and breast cell examination.
Okay. So let's come to the advancements in treatment from traditional to now the targeted therapies that we have. So what role do targeted therapies and immunotherapies now play in modern breast cancer treatment?
Okay, so I'm a medical oncologist and I deal with systemic therapy. So exactly like what you say, I deal with chemotherapy, hormonal therapy, targeted therapies, immunotherapies. Essentially, now with the advancement of all this systemic treatment, our patients live longer. In the past, whenever we used to talk about breast cancer was treated as just one disease. Everybody with breast cancer was just treated in a similar way. Nowadays, we don't look at breast cancer as a single disease, meaning that when we talk about breast cancer, we divide it into three major subtypes. One is the hormone positive breast cancers, and if you have a hormone positive breast cancer, the treatment that you will get will be different from someone who has what we call a HER2 positive breast cancer. A HER2 positive breast cancer is when the breast cancer cells overexpress this protein called HER2. And for these patients, you would have a targeted HER2 targeted therapy. If the breast cancer cells do not express the hormone receptors or the HER2 protein, then these are called triple negative breast cancers. And for these patients, treatment would be different as well. Yeah, the fact that we now have targeted therapy, hormonal therapy, immunotherapy, that increases the patients, even patients with metastatic breast cancer. In the past, we would say, oh no, stage 4 metastatic breast cancer, that's the end of the tunnel, but not anymore. With all this treatment, even patients with metastatic or stage 4 breast cancer can live for many years. It's more of a chronic disease rather than a terminal disease in many cases.
Dr. Tanuja, the next question I have is like obviously this breast cancer and do uh, do we still do breast removal procedures for treatment of breast cancer? Because obviously this is a cosmetic issue which influences a woman psychologically as well. So do we still do that?
Okay. So maybe I take one step back. Whenever we deal with breast cancer, right? Breast cancer care, the cancer care has become so complex. It is generally not possible for one person to deal with a cancer patient. So we usually work in a multidisciplinary team. So, for example, there will be the breast surgeon who is in charge of all the surgical procedures. Then there will be somebody like myself, the medical oncologist, who would deal with the systemic therapy options, meaning the chemotherapy, the targeted therapy, the immunotherapies, hormonal therapies, and then you have the radiation oncologist who will deal with the radiation radiotherapy part, and then we have the pathologist who will read the specimens and decide tell us what sort of breast cancer are we dealing with, and then you have the radiologist. These are people who read the scans. So now what we're talking about is surgery. So even in terms of breast cancer surgery, there's been a lot of advancement, right? So breast cancer does not equate to a mastectomy. A mastectomy means removal of the
Yeah.
entire breast. Nowadays, there's options of what we call breast conserving surgery. So
Yes.
where patients can undergo breast conserving surgery and after that go on for radiation. And nowadays we also have oncoplastic breast surgeons. So that means they can even make very small, tiny incisions that people can't even tell that you have gone for breast surgery. It's not, the pictures that you see in the past where you have just a big scar across
Yeah.
the breast.
Yeah.
And also, even if you have to go for a mastectomy, let's say you have a very advanced tumor and you cannot go for breast conserving surgery, there are many reconstructive options available from our plastic surgeon colleagues who can come in to reconstruct the breast, right? And nowadays, we also give systemic therapy, chemotherapy upfront. One before going for surgery, so that we can downsize the tumor, and that can increase a woman's chance of going for breast conserving surgery, and so that they don't have to go for mastectomy.
So this is very insightful from your end because obviously this influences and impacts women's psychological health and all. because thinking of a surgery or a breast removal basically pulls the woman's psychological ability to fight this disease. So
Absolutely.
this is very insightful from your end that there are so many options available and a person even at a metastatic stage can get over this disease.
Yes.
Typically, how much time does a patient take to recover? I mean, obviously, it depends on the stage as well. But with all the therapies that you have mentioned, and how much time does a person take to recover from the
Surgery.
treatment? Yeah.
Okay, so you usually nowadays, there are some patients, if they are going for a mastectomy, for example, it's almost like a day procedure. They come in the morning, they go for the surgery, and then they're discharged home, right? Of course, if yeah, so it's not like what we imagine. Of course, if you have a more extensive surgery where you need reconstruction, then ladies may need to stay in the hospital longer, and recovery may take a little bit longer. But there's no, whenever we talk about recovery from surgery, for example, it's again a multidisciplinary team working with the patient. So it's just not you. It's not just the patient go for surgery, discharge, and nobody bothers about you after that. So there's a allied health team, the physiotherapists, the nurses
Yes.
that will come in to teach the because we sometimes if you have lymph nodes removed from the armpit area, there may be swelling in the arm, and we want to prevent that. So nowadays we can do surgeries. Our surgeries need not be so extensive as well. And post surgery, there's physiotherapists and occupational therapists who come in to help with the recovery of the patients.
So this is exactly where we were heading in the next segment of our webinar. This was about rehabilitation, recovery, and quality of life post breast cancer treatment. Okay. So as you rightly mentioned, there are physiotherapists, there are occupational therapists who help women recover after surgical procedure or lymph drainage. Because I believe, Dr. Tanuja, if there is a procedure done in the armpit, then it obviously affects the shoulder movements of the women. The shoulder tends to become a little frozen after any kind of treatment under the at the lymph node stage, at the armpit basically. So after treatment, what are the key rehabilitation steps patients should take to regain their strength and mobility, and when should they start? I mean, is it as soon as they get discharged?
I think it's as soon as post surgery, usually the patients get started on they already see the physiotherapist, they start ambulating and they can start some form of exercise. And so usually there's a team of allied health staff that who work with the patients. And it's very important that we want to get them back to normal life as soon as possible. Right. So of course,
Yes.
besides the physiotherapy and the physical exercises that is required, it's also important that emotional support is vital, right? As you rightly mentioned, right? Imagine if you just had a mastectomy, it's a big change to the
Yeah.
women's psychology. So you need to support them psychologically as well, right? Also, you have friends, family, counselors, psychologists in our team to help to deal with our patients as well.
So basically, it's a multidisciplinary approach that is required post the medical treatment,
Yes,
which will involve the rehabilitation experts, which will involve psychologists. Obviously, nutrition would have a very major role for the
yes,
patients to recover after the medical treatment.
yes, definitely.
So, could you share some real world patient success stories with us so that, basically somebody's journey becomes somebody's hope? So,
Yes.
if someone is suffering and wants to is hearing our webinar right now, will get a ray of hope. So, could you share some success stories with us?
Absolutely. So in fact, any new breast cancer patient that comes in to see me, I mean, after we have the consult, obviously they are down. Nobody wants to be told that they have cancer, and I always share some patient experiences to help to uplift them. So I have this patient. She was very young. She was breastfeeding, right, and she was breastfeeding her 2-month-old daughter. right? And she felt a lump, and she very rightly went to go and seek medical attention, and unfortunately that lump turned out to be breast cancer, and the breast cancer was quite advanced by the time she had detected it, and it had spread to the lymph nodes of the neck. And but we started her on, her baby was only 2 months old. We started her on chemotherapy first, right, together with immunotherapy, and we managed to downsize the tumor. She managed to go for surgery, and she's this lady, this is 6 years on. That 2 month old baby is now 6 years old, right? The mother is still
Oh,
around, and she brings that daughter to come and see me now still, right? And both of them are doing very, very well. And if you look at 6 years ago, I mean, when she first saw me, she was devastated. I mean, you can
of course,
understand, right?
of
I mean,
course,
you
of
I mean,
course.
you are 27-year-old. You are just deliver. You just delivered a baby. This is supposed to be a joyful experience, but
Yeah.
I had to tell her you need to stop. You need to stop breastfeeding. We're going to start you on chemotherapy. You're going to lose your hair. I mean, this was as devastating as it can be. And 6 years on, this lady is doing very well. And that little girl, that little girl now wants to grow up to be a doctor. So she comes in with mother to see me at her regular visits. And I always, for some patients who are having difficulty, I always tell her, can you please go and speak to the patient to share your journey and to share your how you've dealt with the situation.
That's really encouraging story. And any story about a person who has you know the cancer detected at a later stage, or not so young to deal with this disease?
Yeah. So that there's another patient who came to see me, right? She was about in her 60s, right? She was diagnosed with about stage it was a stage 3 breast cancer. And and she's a lady who was very sedentary, housewife her entire life, always busy looking after her children, and she got diagnosed with this breast cancer. And as part of my counseling for the patients, I always tell them, when you are on systemic treatment, you need to exercise, right? Because there are many studies that have shown, right, time and time again, among patients who exercise versus the patients who don't exercise, the chances of recurrence is always less in patients who exercise. And so this lady who, she's sedentary housewife, never exercised before. So even during chemotherapy, she went on little walks. She started
Okay.
with short walks, and then I always say good job, good job. And then she started, she realized, "Hey, I could actually walk quite a bit," and then she started jogging, right? And
Okay.
she was diagnosed with breast cancer about the age of 62. And about 5 years later, she took part in a half marathon. Okay, right, 21 kilometers. And this is a lady who has never exercised before until she was diagnosed with breast cancer. In fact, she always tells me, I think breast cancer saved my life.
Yeah, yeah. So
Yeah,
something drastic turned out to be very fruitful for her future
absolutely.
life and her old age.
Yeah,
So basically, where there is a will, there is a way, and with the help of experts like you and the team that you have, patients have hope to get better. And this is really
absolutely.
an encouraging story from your end. So, Dr. Tanuja, let's focus on some myths and misconceptions which will improve the community awareness. Okay.
Absolutely.
So, what are the common myths about breast cancer you wish more people understood?
Okay. I think the first thing is breast cancer or cancer of any sort is a death sentence. I think that is not true because number one, cancer. I mean, there have been so many advances in cancer treatment. So in many a times, even in the metastatic disease or stage 4 setting, patients can live for a long time, and cancer can be seen as more of a chronic disease, just like diabetes, high blood pressure, where you need to take medications long term to control the disease. We can look at cancer that way. And I think the other common myth is that any lump in the breast equals to cancer. That is not true. I
That's
think we
not.
covered
That's
that.
not.
I think we covered that earlier. And there's also this myth going around that mammogram the radiation from mammogram can increase your risk of cancer. That is not true. The radiation from mammogram is very, very low. If you take an aeroplane, you take a transatlantic flight, you get more radiation than what you get from a mammogram, right?
That, that's
I I
that's
think
insightful.
yeah, and also another thing that we also some people feel that cancer is a disease of the older people, which is generally true. Yes, most of our cancer patients tend to be older, but just because you are young does not mean that you cannot get cancer. So if you have any symptoms that are worrying, please go and seek medical attention. Yeah.
The second question I have for you in this section is, how can men also be a part of breast cancer awareness conversations, and what about, I understand that there is 1% out of 100% of male getting a breast cancer. So what do you have to say about that?
Okay, we start with the first part of your question. I think men, because I see many patients, female breast cancer patients, and their husbands or partners, or family members, even their brothers, play a huge role in supporting the women, right? And I see this day in, day out, right? And men who are just there providing emotional support, encouragement to the patient, right? And I think that is really we cannot quantify that, but it
Yeah.
brings a lot of value to our patients. I think your second question is about breast cancer in men. Can breast
Men,
cancer occur in men? Yes, they do, but it's very, very rare and very uncommon. But the chances of it occurring in men is higher if you have a family history of cancers, right? If you carry the genetic mutation, then there's increased risk of male breast cancers. But again, I think it comes down to the point that if let's say if you're a man and you feel a lump on your chest, or you feel a lump in the armpit, definitely go and get it checked out. Yeah, I think that would be the main advice.
so what is your advice to communities and organizations like MediGence to help strengthen the awareness, screening, and the support system for breast cancer?
I think doing what you're doing, increasing awareness, right, to women in general about screening, about breast cancer, right? I think awareness is number one. Educating the patients on what to look out for, and even if let's say you get diagnosed with breast cancer, there are many advancements in treatment, right? So the chances of getting cured is also high. And I think to also destigmatize breast cancer and just talking about this and having campaigns, the Breast Cancer Awareness Month, and promoting breast cancer awareness, I think that is very important. And also, like sharing survivor stories and things like that, I
Yes.
think that would help. That would help.
Okay. So, finally, as a message of hope, what would you like to tell women, and of course, 1% of that men population also, that about this during this breast cancer awareness month? What is the message that you want to give to our viewers?
I want to say number one, breast cancer is no longer a death sentence, right? With early detection and modern treatment, survival rates for breast cancer are very high. Breast cancer awareness saves lives, so it's important for us to stay informed, stay proactive, and support one another.
Okay. So, Dr. Tanuja, for you, there are some questions from our viewers. I would like to talk about them one by one. Why are fibroedema commonly seen in younger women? This is a question from, I think you have answered this, but can you throw a light on this question by one of our viewers, please?
So basically, fibroadenomas, as I said, is a benign tumor, and fibroadenomas generally hormonal fluctuations tend to stimulate the growth, right? And when you're younger, you have more estrogen, chances of fibroadenoma becoming more visible, becoming more prominent. This happens when you're younger. But I think the main point is if you have a lump, get it evaluated. So it does not mean if you're a young person, the lump in your breast is going to be a fibroadenoma. We don't know that for sure, right?
Yeah.
We need this to be evaluated.
So
Yeah.
only a detailed evaluation will let us know the final diagnosis.
Yes.
So there's a very interesting question, Dr. Tanuja. Can breast cancer treatment be altered for pregnant women, and what are the options that are safe if
Okay.
a pregnant woman develops breast cancer?
Okay, so that's a very complex topic, right? And yes, we can give treatment to pregnant patients, and it's something that we have given to pregnant patients before, but it depends on which stage of their pregnancy they are in. Usually not in the first trimester. We have given the only thing that we can give during pregnancy is chemotherapy. Right, and when we give chemo, so I have given chemotherapy to pregnant patients usually in the first trimester, but we also need to work very closely with the obstetrics team as well to ensure that the baby is growing well, and we need to deal with delivery. When do we deliver the patients and things like that. Yeah, but yes,
So
treatment
is
can be.
okay.
We can give treatment to pregnant patients without asking them to abort their baby.
That's a ray of hope basically.
Yes.
So is it safe to have a baby after recovering from breast cancer?
I think it depends on the type of breast cancer that you have. So if it's a
Mm-hmm.
hormone positive breast cancer, generally
Mm-hmm.
pregnancy causes estrogen stimulation that can cause cancer to grow. So usually what we will tell patients after your diagnosis of breast cancer, assuming it's early stage breast cancer and it's a hormone positive breast cancer, then they will need to be on some hormonal treatment. You would need to continue with the hormonal treatment at least for a 2-year period, and then take a break, get pregnant, and then you need to continue on your hormonal treatment again. This is a very complex discussion. Usually, we spend quite a few hours in the clinic just discussing about this, but it's something that's something that needs to be discussed with both the patient, the doctors, and the gynaes as well.
Gynec team is so, according to the Indian study, Dr. Tanuja, postmenopausal women have 2.5 times higher risk of breast cancer compared to premenopausal women. So, is it the trend worldwide, and what do you have to say about this?
Okay, so generally, as I said, cancer is a disease of the older people, right? As we age, the chance of getting cancer increases because genetic mutations increase. So it's rather than purely as something that is related to the menopausal status, it's more related to age.
Okay.
Mm.
One of our viewers has asked this question that some reproductive factors appear to reduce breast cancer risk. For example, like um, early first childbirth, higher parity, and longer duration of breastfeeding. So, are these contributing do these contributing factors reduce the risk of having a cancer?
Yes. Yes, so earlier age of first pregnancy,
Yeah.
the increasing number of pregnancies, and this, yes, it does, and breastfeeding decreases the risk of breast cancer, but it decreases your risk factor. It does not prevent cancer,
Okay.
right?
That's it from our viewers, Dr. Tanuja. And thank you for this insightful session. For our viewers, there's a message that prevention of breast cancer may not be possible, but yes, you can detect cancer by self examination and obviously getting yourself examined at the earliest possible time with your gynecologist or consultant to basically diagnose and then find the treatment if it is a cancer. But as Dr. Tanuja said, cancer is not, as you were mentioning, it's not a death sentence. The treatment is possible. Advancements in in this area has developed so much that even metastatic cancers have the hope of getting cured. And since we heard the story of a 63-year-old going for a 21 kilometers marathon after a breast cancer treatment, so I think our viewers have a very good ray of hope after listening to this webinar. Thank you, Tanuja, Dr. Tanuja,
Thank
and
you so much for having me. It's truly a pleasure.
thank you, ma'am. Thank you for your time.
Thank you. Thank you for your question. See you.
Bye.
Thank you.